Do you ever find yourself walking into a room and forgetting why you went there? Or maybe you struggle to remember the name of someone you just met. It's a common experience, isn't it? We often shrug it off, saying, "Oh, it's just old age." Millions of people in our age group experience these little memory slips, and while some forgetfulness is a normal part of aging sometimes it can be a sign of something more significant happening that could deeply affect our future independence and well-being. Today, we need to talk about cognitive decline and a condition many people worry about, dementia. But instead of focusing on fear, we're going to approach this topic simply focusing on understanding what's happening and what can be done. This isn't just about forgetting where you put your keys. Cognitive decline, left unchecked or misunderstood, can slowly erode your confidence, make simple daily tasks feel overwhelming, and eventually, yes, it can take away some of that precious independence we all value so much. You might think it's just inevitable as we get older, but the truth is, understanding it early, recognizing the signs, and taking proactive steps can make a world of difference. It's about protecting your ability to live life on your own terms for as long as possible. In this video, I'm going to share 6 simple but crucial things you absolutely need to know about cognitive decline and dementia. These aren't complicated medical lectures. They are practical insights and actionable steps that can help you understand what's normal, what's not, and how you can support your brain health right now. Before we dive into the details, if you're also concerned about brain health or know someone who is, please take a second and hit the like button right now. It helps this information reach more people. And if you haven't already, be sure to subscribe to the channel and ring the notification bell so you don't miss future health tips tailored for us. Let me know you're watching by commenting brain health below. All right, let's start with the very first crucial thing you need to understand about cognitive decline. Point 1. Understanding the difference, normal aging versus significant decline. The first thing to grasp is that not all memory changes are the same. There's a difference between normal age-related forgetfulness and something more serious. Think of your brain like a library. As you get older, it might take a little longer to find a specific book of memory, or you might misplace a book occasionally. That's normal aging and minor retrieval issues. Significant cognitive decline, and eventually dementia, is more like the library's catalog system breaking down, making it genuinely difficult to find information or even navigate the library itself. Normal aging doesn't significantly impact your ability to perform daily tasks, while dementia does. I remember my friend Mary. She's in her late 70s. She'd get so frustrated because she'd forget names more often or couldn't recall exactly what she had for breakfast yesterday. She was convinced something was seriously wrong, but when she talked to her doctor, they did some simple tests and explained that her type of forgetfulness, the occasional tip of the tongue, moments or misplacing glasses, was typical for her age and didn't affect her ability to manage her home, pay bills, or enjoy her hobbies. Understanding this distinction brought her immense peace of mind. Knowing the difference is vital. It helps you avoid unnecessary worry about normal changes and also empowers you to recognize when symptoms aren't normal and need attention. Keep a journal to track your own memory or thinking changes if you're concerned, and note when they happen and what they involve. This is helpful information for a doctor. Point 2. Recognizing the early, subtle signs. Beyond simple forgetfulness, there are earlier, more subtle signs of significant cognitive change that are important to notice. These aren't always about memory loss first. Sometimes they involve difficulty with planning or problem solving and maybe struggling with a recipe they used to make easily, or finding it hard to manage monthly bills. Other times, it's confusion with time or place, like getting disoriented in a familiar neighborhood or trouble following a conversation. It's a change from a person's previous abilities. My neighbor, Robert, is a retired engineer, always sharp with numbers. His daughter started noticing he was having trouble balancing his checkbook, something he'd done effortlessly for decades. Then he got lost driving to the grocery store he'd visited every week. These weren't just one-off mistakes. They represented a noticeable change in his capabilities that his family recognized as different from simple aging. Spotting these changes, not just isolated incidents in yourself or a loved one, is key. It's about observing a pattern where familiar tasks become genuinely difficult. Are any of these signs sounding familiar? Let me know in the comments below. Point 3. Why early detection and diagnosis matter immensely. Many people fear a diagnosis of dementia, but getting an early, accurate diagnosis is actually incredibly important and beneficial. Firstly, it can rule out reversible causes. Many conditions, like vitamin deficiencies, thyroid problems, infections, or even depression, can cause dementia-like symptoms and are treatable. Secondly, if it is a form of dementia, while there isn't a cure yet, treatments and therapies are available that can often slow the progression of symptoms for a time, maintaining cognitive function longer. Finally, it allows for crucial planning, legal, financial, and care planning while the individual can still participate in these decisions. Susan, a woman I know through a community group, was diagnosed with early-stage Alzheimer's a few years ago. It was difficult news, of course, but because they caught it early, she and her husband were able to work with doctors to try medications that helped manage her symptoms for a while. More importantly, they had crucial conversations about their wishes, sorted out their finances, and put plans in place for future care together. This proactive approach gave them a sense of control during an uncertain time. An early diagnosis isn't an ending. It's a new starting point that allows for management, planning, and making the most of the time ahead with clarity and agency. Point 4. Lifestyle factors that significantly support brain health. While there's no guaranteed way to prevent dementia, our lifestyle choices have a powerful impact on brain health as we age. Things like regular physical activity, a healthy diet, getting enough sleep, staying socially active, and keeping our minds challenged all work together to support brain function. Exercise increases blood flow to the brain. A balanced diet provides essential nutrients. Social interaction and learning new things build new brain connections. These habits create a more resilient brain. Look at John. He's 85 and sharp as a tack. He attributes much of it to staying active. He doesn't run marathons, but he walks for 30 minutes every morning, tends his garden, and plays cards regularly with friends. He also makes sure to eat lots of vegetables and fish. He wasn't doing this specifically for dementia prevention, but these habits have kept his body and mind engaged for years, and his doctor always comments on his excellent cognitive function for his age. Simple, consistent lifestyle choices aren't just for physical health. They are directly nurturing your brain and potentially slowing age-related cognitive changes. Which of these lifestyle habits do you practice? Share your favorite in the comments. Point 5. The critical role of social connection. One of the most overlooked factors in brain health, especially for seniors, is staying socially connected. Social interaction is like exercise for your brain. Conversations, group activities, helping others, they all require complex cognitive processes like memory retrieval, attention, problem solving, and emotional intelligence. Isolation, on the other hand, is linked to faster cognitive decline and higher risk of depression, which can mimic or worsen cognitive symptoms. David retired a few years ago and initially felt a bit lost and lonely, spending most days alone at home. He noticed he felt foggy and less motivated. His daughter encouraged him to join a local book club and volunteer at the community center. Within months, David seemed like a different person. He was more alert, happier, and his memory seemed sharper because he was constantly engaging with people and ideas. His social life revitalized his mind. Making an effort to stay connected with friends, family, or community groups isn't just about feeling good. It's a vital strategy for maintaining cognitive vitality. Point 6. When and how to seek professional help. Perhaps the most important thing is knowing when it's time to talk to a doctor and how to approach that conversation. If you or a loved one are noticing persistent changes in memory, thinking skills, or behavior that are impacting daily life, a difficulty with familiar tasks, confusion, poor judgment, changes in personality, it's time to see a doctor. They can perform assessments, order tests like blood work or brain scans, and determine the cause of the symptoms. Remember, it might be something treatable. My friend Barbara was very worried about her husband, Tom. He'd become withdrawn, seemed confused, and his memory was failing rapidly. She thought it was advanced dementia. However, after seeing their doctor and doing some tests, they discovered Tom had a severe vitamin B12 deficiency. With B12 shots, his cognitive symptoms significantly improved. It wasn't dementia at all, but a treatable medical issue. This highlights why getting a professional evaluation is critical. Don't try to diagnose yourself or a loved one. A professional medical evaluation is the only way to get an accurate diagnosis and explore potential causes and treatments. So, how can you put some of this into practice? For brain-healthy eating, think colorful fruits and vegetables, whole grains, lean proteins like fish and poultry, and healthy fats from nuts, seeds, and olive oil. Aim for 30 minutes of moderate exercise. Most days of walking, swimming, or gentle aerobics are great. Keep your mind active with puzzles, reading, learning a new skill, or playing challenging games. Schedule regular social activities, a coffee date, a club meeting, or just a phone call with a friend. Avoid isolating yourself. Don't ignore persistent symptoms, hoping they'll go away. They usually won't without attention. Don't rely on unproven supplements without talking to your doctor. And please, avoid self-diagnosing based on things you read online. Get professional medical advice. If mobility is an issue for exercise, try seated exercises or water aerobics. If large social gatherings are tiring, focus on smaller, one-on-one interactions. Find activities you genuinely enjoy, whether it's gardening, painting, or online learning, to keep your mind engaged. This is crucial if you are experiencing concerning cognitive changes or are worried about a loved one. Please consult your doctor. They are the best resource for diagnosis and guidance. As we discussed, understanding the difference between normal aging and significant decline, recognizing early signs, seeking timely help, and embracing a brain-healthy lifestyle are powerful steps. They are about much more than just memory. They are about preserving your quality of life, maintaining independence, and enjoying your years ahead to the fullest. None of the things we talked about today are rocket science. They are simple, actionable steps that you can start incorporating into your life right away. I know it can feel daunting or even a little scary to think about these things. It's tempting to just brush off changes, but ignoring the subtle signs or delaying seeking help out of fear can mean missing opportunities for treatment, management, and crucial planning. It can lead to unnecessary difficulties and loss of autonomy down the road. But here's the empowering truth. You have the ability to influence your brain health journey. It's never too late to adopt healthier habits or to seek an evaluation if you're concerned. Age is just a number, but how you choose to live and care for yourself in these years makes all the difference. You have the right to choose a future where you are as healthy and independent as possible. So, as you can see, paying attention to our cognitive health isn't about fearing the worst. It's about empowering ourselves with knowledge and taking proactive steps. It's about safeguarding not just our memory, but our ability to connect with loved ones, pursue our passions, and live a life filled with joy and purpose. After watching this video, what is one thing you learned that surprised you the most? Or what's one small change you feel you could make starting today? Please share your thoughts in the comments below. I'd love to hear from you, and so would others in our community. If you found this information helpful, please give the video a thumbs up to support the channel. If you haven't yet, subscribe for more helpful health tips. And most importantly, if you know someone, a friend, a family member, a neighbor who might benefit from hearing this information, please share this video with them. This knowledge can make a real difference in someone's life. Thank you for watching and for taking this important step towards understanding your brain health. Wishing you and your loved ones health, happiness, and many more years of sharp minds and joyful moments. See you in the next video.